LQTS is a disorder of the heart's electrical activity. It can cause sudden, uncontrollable, dangerous arrhythmias in response to exercise or stress. Arrhythmias are problems with the rate or rhythm of the heartbeat. It can also kill within years of the first signs. The frequency of long QT syndrome is about 1 per 2,000 people. The condition is present in all races and ethnic groups, although the frequency may differ among different populations. LQTS is more commonly found in males, and it affects every age. This is Jason Hart. He is 9 months old and is diagnosed with long QT syndrome. Anything he does that could startle him are off limits. A simple nursery rhyme, like Running Around the Rosie, cannot be sung to him because it could stop his heart when he is shocked by some of the sudden sounds. He is also not allowed to play with squeaky toys or rattles because of the loud noises could cause his heart to stall. His parents must be very careful at all times. Once, when his grandmother broke a glass, his body started to turn blue. Jason's mom, Kelly Hart, knows how to deal with his condition because she was diagnosed with LQTS when she was 10 years old. Jason is not allowed to do anything that could trigger his heart arrhythmias because a rush of adrenaline that could cause them. His parents cannot have one relaxing moment of any part of their day because they're always worrying about their son's health because of his condition. There are at least 17 genes associated with long QT syndrome. Mutations in 3 are these genes causes most of long QT syndrome causes. Mutation in 14 of these genes cause few cases. There are hundreds of mutations involved in this disorder. There are 2 different ways this disorder is passed on. One way is Romano-Ward syndrome, where people only inherit a single genetic variant from one of their parents. This is more common. Another way is Dravet and Lange-Nielsen syndrome, where children with long QT syndrome are born deaf because they inherit genetic variants from each parent. The disorder is usually inherited as a dominant trait, Romano-Ward, although sometimes there is a rare recessive inheritance, Lange's.
LQTS1 involves chromosome 11. The mutations of the gene affect transmissions to sodium and potassium channels. These are small passages in the cell membrane. KCNQ1 is a gene that provides instructions on how to make potassium channels. It transports positively charged atoms, or ions, out of the cell. It's located on the short arm of chromosome 11. In the heart, the channels recharge the cardiac muscle after every beat. It helps maintain a steady rhythm. In LQTS2, gene KCNH2 on the long arm of chromosome 7 is affected. This is another potassium channel, and it has the same purpose as KCNQ1. It is also found in nerve and immune cells. Another type of disorder, LQTS3, is a gene found on the short arm of chromosome 3. It has instructions to make sodium channels and helps coordinate contractions of the upper and lower chambers of the heart. Mutations of these genes are what causes LQTS.
There are no physical characteristics of the disorder, meaning that there are no discoloration or disfiguration of the hair, skin, bones, or nails. Diagnosing LQTS is not a very simple task, since there are no physical characteristics that can be seen on the outside of the body. Doctors generally take blood pressure and heart rate to rule it out, but to be sure they must ask about the family history and review symptoms.
Fainting is a very common symptom that comes with long QT syndrome type 1. This is caused by the heart beating in uneven patterns. There are typically no warning signs that could signal the person affected will experience this. When experiencing emotions or movement, this could be a trigger. Even the ringing of an alarm clock could startle you, which would throw off the beating of the heart. Swimming is also a very common form of exercise that puts a lot of strain on the heart. Seizures are also a biological symptom of this disorder of the heart. When the brain does not get enough oxygen, this causes the heart to beat erratically, leading to seizures. Another symptom, while not extremely common, is sudden death. If the heart does not go back to normal, it could be too late for it to correct itself. Though these are very disturbing effects of long QT syndrome, there are methods that could be put in place to help stop these symptoms. It may be a challenge to live with this syndrome, but there are plenty of ways to improve their quality of life. Even though this disorder cannot be cured, there are plenty of things that can be done to help make things less severe. Taking medication is a very easy way to help the person. Beta blockers are arguably the most popular and most common way of calming the heartbeat. They can slow down the heart rate while lowering the risk of an unsteady heartbeat altogether. It also blocks how the heart reacts to emotion and exercise, which we know are the most prevalent ways that cause the heart to beat in an abnormal fashion. Potassium is also good for the heart. If taken in supplements, this could improve the heart tremendously. Along with this form of treatment, devices and surgeries could play a part in improving overall health. A pacemaker or implantable cardioverter defibrillator or ICD can improve the heart rate. These devices shock the heart and corrects the strange rhythm automatically. A left cardiac sympathetic denervation surgery can also be done. This is like a last resort for cases that see no improvement in any ways. Nerves in the chest are taken out in order to control the regulation of beating. There are also simple changes in the way you live that can help all the same. Staying away from emotional straining activities and putting yourself into quiet and calming environments is an easy fix. Staying hydrated and out of rough sports is also a smooth lifestyle change that should be an easy transition. These adjustments make the tough emotions and activities less likely to put strain on the heart.
More than half of people who have untreated types of LQTS die within 10 years. LQTS is responsible for many unexpected and unexplained deaths in adults and children. It is not often recognized as a cause of death.
Punnett squares and pedigree charts can both predict the probability of the genetic disorder being passed down. LQTS is a dominant gene, so it does not skip generations. The disorder is passed directly from parents to children. This Punnett square shows that if one parent had LQTS and one did not, there would be a 50% chance that the children would inherit the trait. The pedigree chart begins with a female who has LQTS. She passes it on to her 2 sons, and her daughter becomes a carrier. One of those sons gets married and has 4 children. 2 of the daughters become carriers, 1 is unaffected, and the son inherits the disorder. Michael J. Ackerman, MD, PhD, is a medical doctor researching the effects of LQT syndrome and SQT syndrome at Windland Smith Rice Sudden Death Genomics Laboratory in Rochester, Minnesota. He has proven that the syndrome can be dormant for many years, but once it starts, it cannot go away on its own. He has also discovered that for those who have extreme cases of the disorder, they can barely handle running without their heart putting them in danger. He created the electrocardiogram, ECG or EKG, which is a diagnostic tool that is routinely used to assess the electrical and muscular functions of the heart. While it is a relatively simple test to perform, the interpretation of the ECG tracing requires significant amounts of training.
The SADS Foundation is dedicated to informing the public and keeping them aware of how to stop sudden death as a result of cardiac disorders. SADS, or Sudden Arrhythmia Death Syndromes, encompasses many disorders involving the heart. Long QT syndrome is one of the most well-known focuses of this foundation. They try to get plenty of attention in this topic, and there are many event dates already set in place. There is even a benefit that will take place April 30th. They also set up a lot of media attention. The news, radio, and TV contain ads that are put in place by this foundation. They also encourage donations and volunteering, which can be found on www.sads.org. Donations are another huge part of what this group is dedicated to because the money goes to research for long QT syndrome. As another way of getting the heart issues out there, the SADS Foundation sponsors a SADS Awareness Week that was once known as Long QT Syndrome Awareness Week. There are many gatherings and activities that take place for this time period. There are also public awareness meetings that are set up in local areas.
LQTS is not dangerous in itself, but what it causes is. When heartbeats are drawn out, hence too long, the heart can become extremely tired, which can cause cardiac arrest, a heart attack. It can also cause idiopathic or atrial arrhythmia, a condition in which the heart beats with irregular or abnormal rhythms. Since LQTS is already a diagnosed arrhythmia, the other types can become life-threatening. Arrhythmia symptoms are pain, shortness of breath, lack of physical ability, and extreme fatigue. LQTS can also cause ventricular fibrillation, which is a condition in which there are uncoordinated contractions of the cardiac muscles in the ventricles of the heart, making them shake rather than contract properly. Ventricular fibrillation is the most commonly identified arrhythmia in cardiac arrest patients. It is chronic and can kill within a few years of the first signs. Long QT syndrome is a disease that is statistically more likely to kill people more than cancer. It causes so much pain and so much suffering in the most precious organ. It not only kills, but it prevents people from living a normal life. LQTS is difficult to live with, and with SADS and other foundations, we hope to get closer to a cure for the destructive disease.